mental health issues are so prevalent in our society, and yet we're undereducated about them. And that often leads to us either not getting treatment or not getting treatment soon enough. And we know that the sooner that mental illnesses are detected and treated, that the better outcomes we have. And so doing that prevention, education piece, getting out front of it and spreading that word, to me is really important to lower the stigma so people do get medical help when they have a medical issue. Well, what I told the students was, my goal is that they leave here today, or that they would have left here today, understanding mental health better than when they came in, that they understand how to pay attention to their own mental health, to look for warning signs, to know how to reach out for help if needed, to know how to talk to a friend who might be struggling, to be able to give that support. So really that mental health made sense to them when they left today, rather than maybe just being a topic that they hear about or know is important. With my personal story, I've just learned that there are a lot of threads of it that happen to be common threads of other people's struggles. And so being able to open up and tell my story, and really that I was able to perform and achieve at levels that I never thought I could, and that I never could before I was sick. That is to say, I achieved at higher levels after getting treatment, after really having my brain and my body both working how they're supposed to be. And so sharing my story to me is important, because if it allows one other person to get the help that I so badly needed, that they may need as well, then I've done a good job, and you get many of those and you make the world a better place.
Well, as I hope most people understand, the mental health crisis in young people, and both here in our district and throughout Michigan and the United States is a major issue. Williamston is doing a number of different things to take this on and be proactive in terms of addressing it. One of our major goals is to really focus on destigmatizing mental health, both amongst our students, and then also opening up lines of communication between students and their parents, their coaches, other adults in their lives, and being able to have open and honest conversations about some of the things that are taking place in the lives of our young people. Well, I think the biggest thing is the takeaway that it's okay to talk about this. And we'll talk about, when you have an injury to your ankle, you get treatment as an athlete, right? If there's a sports injury, if you're suffering from an illness, you go to the doctor, you get treatment. Well, mental health is the same way. And in order to get that treatment, you need to seek out support and assistance. And so traditionally, this has been a topic that's been very difficult for people to talk about, and people felt uncomfortable just bringing it up. We're trying to take away those barriers, both between students talking to their peers about it, and then, like I mentioned earlier, also students having conversations with parents, parents having conversations with their children, and really getting this out in the open.